Then we followed the participants up for 5 years, as I said, and we showed that the 5-year disease-free survival was more than doubled. So the disease-free survival remained consistently high over the 5-year period. When looking at overall survival, the difference was only significant in the stage 3 group. We then had a very interesting experience or subgroup. When we looked at the PET-CT studies at 6 months post-treatment, we saw that in fact 108 of the participants had extrapelvic disease on the pre-treatment PET studies, which we hadn't seen during the staging workup. There were 54 participants in each group with extrapelvic disease or stage 4B disease. And interestingly, in the group that received the hypothermia treatment, a quarter of the participants at 6 months showed complete metabolic resolution of all disease, extrapelvic and pelvic disease. So we obviously ran a few analyses to determine the most likely cause of this, and this response was not significantly associated with the number of chemotherapy doses or age or radiation dose or any other variable except for the hypothermia. And interestingly, we saw this response equally in the HIV positive and negative participants in this subcohort. So we hypothesized that this is a potentiation of the abscopal response by the modulated electro-hyperthermia. We followed the participants up for 5 years and saw that most of the participants who had this potential abscopal response remained disease-free at 5 years, with the exception of 2 participants who passed away from non-cancer related causes. So this seems to be the potentiation of a systemic response and most likely an immune-mediated response, as it's most widely acknowledged that the abscopal response is due to an immune response. So to conclude, the addition of modulated electro-hyperthermia added to the management of cervical cancer in our setting resulted in a significant improvement in local disease control, 5-year disease-free survival. It was cost-effective, did not alter the toxicity profile, and potentially promoted a long-term sustained immune response to disease when combined with radiation therapy. Obviously, a study of this size requires a dedicated team, and I'd like to thank the Department of Radiation Oncology and Nuclear Medicine at Charlotte Macleod Johannesburg Academic Hospital, as well as my supervisors and co-PI, Dr. Jeffrey Kotson and Prof. Ans Baines, and anyone who knows what it's like in the resource-constrained setting will understand how important the participants are and how difficult it is for them to show up regularly for all their follow-ups with courage and grace. And so without the participants in the study, this wouldn't have been possible. So big thanks to them. And then thank you to all of you for listening. I hope you enjoyed the talk. And yeah, thank you very much.